clean, hot water, the most basic healthcare tool, until now unavailable at most government clinics in impoverished Swatini, formerly known as Swaziland. Doctors say hand-washing, hygiene, and sanitation are key to curbing the spread of illness. Coronavirus has claimed nearly 700 lives in this nation of just over 1 million people. In recent months, a multinational initiative has supplied every public clinic in the country with this precious tool by installing an outdoor solar-powered hand-washing station. VOA asked Eswatini's acting prime minister what seems like an obvious question. Why didn't the government do this before? Why wait for foreign donors? Well, he replied, it's not that easy for a cash-strapped government with limited manufacturing capability and an unreliable electricity supply. When the pandemic hit, he said, Eswatini struggled to acquire basic things like face masks.
One of the priorities was to build the clinics first, because you can't put the stuff here without clinics. As we were building the clinics, as we have 92 of them now, those public health facilities, the stakeholders came in, they wanted to assist, and we gladly accepted that. So everything is prioritized. Health is one of our major priorities, and this is why we thought building the clinics before we get the hot water would be ideal.
This clinic near the capital sees 600 patients a week. Nurse manager Lindiwe Magongo says they also use the hot water station to clean the clinic and brew tea for staff. It also breaks what she described as a stigma around hand washing.
Whenever we wash hands, it means we are going to eat. Going and washing hands all the time, it's an African. We grow up knowing that it's an African to keep on washing hands. Why? There's always that why. Why do you keep on washing your hands?
So how do you break the taboo? How do you break that?
This is going to break it. And COVID-19 has also helped us in breaking that.
A year ago, Australian solar energy entrepreneur Robert Frazer landed in Eswatini for 2 weeks of meetings. Then the pandemic struck, and as he sat in lockdown halfway across the world from home, he thought, why not do something? In that year, his company, with extra funding from the German government, has installed 92 of these $3,500 stations. It's simple, and that's the point.
There was a very obvious need, and we had the products, we had the relationships, the expertise to actually deliver a project that would really make a difference in a very short amount of time, and actually, to be frank, for a reasonably small amount of money.
Frazer stresses that he's not running a charity. They're a for-profit company, and this project has paved the way for a $100 million solar storage project in Eswatini. Health Minister Lizzy Nkosi says hand hygiene is a key weapon against the virus, and one that Eswatini needs while it launches its mass vaccination campaign in coming weeks.
It's not only bringing hot water in places where we would never have dreamt would have hot water, but is reinforcing age-old infection prevention measures that the ministry employs every time, whether we have an outbreak of measles, of diarrhea, an outbreak.
Don't take clean, hot water for granted, she said. In these challenging times, the Emaswati don't. Anita Powell, VOA News, Lobamba, Eswatini.